I'm Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. Hi, I'm Tamara Thomas, editor-in-chief of Urban Health Today, and I'm speaking with Javay Walton, Vice President of Diversity, Equity, and Inclusion for Vituity, a physician-owned healthcare professional staffing company. He's here to talk about trends he's seen in recruitment throughout the pandemic. Thank you for talking to me today, Mr. Walton.
Absolutely. Thank you for having me.
Great. Let's get started. So tell us about your role at Vituity.
Sure. As you mentioned, I'm the Vice President of Diversity, Equity, and Inclusion, and really my day-to-day is focused on looking at the processes, practices, and policies that we have in place within Vituity and making sure that there's equitable access to opportunity for not only our talent internally, but also externally, making sure people are able to access jobs and have recruiting and leadership advancement where needed. You know, one of the things that I kind of focus on within Vituity and sharing with people is this notion of zero barriers. And I want that to be a part of Vituity's way of culture in terms of DEI, is that we're creating zero barriers for recruiting and leadership advancement. We've done some wonderful things over the course of the past couple of years, and I hope I get a chance to share sprinkle some of those things that we've done in terms of like our impact event and Bridge to Brilliance incentive programs for physicians of color, as well as some of the partnerships that we've strategically had that, again, advances physicians of color within the healthcare industry.
Oh, I'm happy for you to talk about it if you're ready to talk about it now.
Sure, I can talk about it now. so we've been fortunate to
barriers. This is all something very exciting.
Yes. So we've been fortunate to roll out some existing exciting programs within Vituity, again, to aim at increasing representation in healthcare, because we know that there's not a lot of Black, Latino, and Native Americans physicians, but then also those that are in the healthcare industry. How are they being able to get access to opportunities with existing organizations? So the first thing we have an event called Impact Forum. And so it's a half-day session that connects future physician leaders with some of our current physician leaders. And so it's an opportunity for them to not only connect, network, and learn from these physician leaders, but also we focus on how they can impact their communities, go back and impact their communities, share journeys and ways that they can get opportunities of a lifetime through how they impact their careers as well. So giving them tips and tools of what some of the hiring managers and physician recruiters are looking for when they're looking at candidates in the market. And then also how to impact your finances. We try to give them tools to begin thinking about building generational wealth. Even though they are coming out of school and out of residency in the midst of debt, but we want to be able to start giving them some tools that they can utilize. So it's a unique design support system for physicians and upcoming physicians that from historically marginalized populations. The second thing that I mentioned was the Bridge to Brilliance Incentive Leadership Program. So this offers access straight into Vituity as a physician partner. So for Black physicians and Latino physicians, they're able to, once they join Vituity, there's an incentive around that. And then there's also access to our administrative fellowship program, which is a track into leadership positions within Vituity. So if anyone that's tuning in is interested, just go to vituity.com to learn more information about it. And so, yeah, we have some exciting things that are happening. Another thing that I'm going to note is also our strategic partnerships. Again, to increase representation in healthcare, we've partnered with the American College of Emergency Physicians, as well as Society of Hospital Medicine, to start a diversity scholarship. And so Vituity has been sponsoring that over the past year to award a couple residents and medical students, again, in their career for healthcare.
That's fantastic. Can I ask you one question about what you were talking about there? I know you talked about recent graduates in the medical school debt. there was a piece in the New York Times last year about the fact that so many graduates of color are mired in so much debt that they can't go into primary care practice because they just can't afford, because of the amount of debt, they can't afford the sort of lower paying primary care positions, which would give them an opportunity to give back to their communities. Have you heard any of that? Can you talk about that at all?
I've heard that, and as you know, like going through medical school and residency, it is costly. And so I heard that a lot of folks are discouraged because, again, especially for Black and Latinx physicians, when they are interviewing for different positions, a lot of times they're not pushed through, for various amount of reasons. But I have heard that. I don't know all the details in terms of, especially as it relates to primary care physicians, because we focus primarily on emergency medicine, hospital medicine physicians. But I have heard that, and that's another reason why we have impact and have that focus, that section on impact and finances. We have a professional financial advisor come in, again, people that look like them, so that they can relate to their circumstances to kind of help them with that debt coming out of college or coming out of residency.
So what trends did you see during the pandemic? And what types of HCPs were in demand?
Yeah, absolutely. So I can't say the pandemic reshaped all of us, right? So from the workforce to even the emergency department, everything we thought we couldn't do, we had to find a way to do it. So globally, there was a shortage of primary care providers and nurses. But again, it's not really Vituity's bread and butter. However, for Vituity, we saw that there was a great need for more advanced providers. So the physician assistants and nurse practitioners for emergency medicine and critical care physicians. A lot of folks were not going to their routine care and it wasn't happening, and they ended up going to the ER, which was already, packed and had shortages of staff, but also packed with COVID patients. So our HCP colleagues, were on the front lines day in and day out, trying to not only keep patients from dying in the waiting rooms or in the hallways, but they also saw heightened fatigue, trauma fatigue that they were going through themselves, witnessing all of this. And then now we're seeing trends of more HCPs that are dealing with burnout and mental issues, all stemming from what was happening through the pandemic. And so, they're also wanting more organizations to have wellness programs for them. And so, one thing Vituity does have is we have a wellness program designed and led by some of our extraordinary physicians to promote wellness for our physician colleagues. So I would say, again, some of the trends really were the demand for more of those critical care, emergency medicine hospital staff, because the emergency rooms were just flooded with so many COVID patients.
Yeah, so you just talked about, right, that routine care for patients became practically non-existent, save for COVID cases and really emergency cases. So what happened to those HCPs? Were they redeployed? Were any of them redeployed to frontline positions? Were any furloughed?
So some were, many of those HCP transitioned to telemedicine. And I can speak for, for Vituity, we had a lot of physicians that transitioned over to telemedicine. Again, with the height of all the COVID patients, and then also those folks that were scared to go to the ER as well, they needed some type of care. And so there also was a majority of physicians or healthcare providers that were deployed to other sites across the nation to help alleviate some of the strain from the COVID-19 patients admitted into the ED or into the hospital. So Vituity, we also sent a group of California physicians to New York during the pandemic to kind of help some of the hospital systems out there, because even though it may not have been necessarily their practice or their community, but in healthcare and in caring for patients, it's all one community. So we were able to send folks there. But then in terms of the telemedicine that a lot of folks were transitioned to, for Vituity, we were fortunate enough that we had already started an emergency telemedicine strategy that was already existing. So it wasn't anything challenging for us. It wasn't anything new for us. It was just easy to kind of transition over to this. In terms of furloughs, I can't speak for every health system or every healthcare organization, but I know for Vituity, we didn't have very much furloughs because, again, we tried to either redeploy people across the nation to help out other hospital systems or transition them to telemedicine. So our focus has been and will always be, to make sure that there's continued care delivered to our patients.
During the course of the pandemic, with the realization dawning on everyone that yes, there is inequality in our healthcare system, did you see any changes in hiring trends, specifically in recruitment of doctors of color?
This is where I have to, really put on my DI hat and say, the pandemic opened the eyes for many organizations, but for people of color, we already knew these inequities existed.
Right.
So we've known that there's always been underrepresentation of physicians of color, especially Black and Latinx. And so that's why one of the things for Vituity, what we did was about 5 years ago, one of our physicians cultivated a DI partnership with ACEP, again, the American College of Emergency Physicians, to form the diversity section meeting there. And so what that is was a way to, again, how to increase representation within healthcare, creating mentorship programs, creating, again, funnels for talent pipelines. But in terms of the hiring trends, I would say not much has changed in terms of hiring trends. We knew then, like we know now, that there's still more to be done for recruiting Black, Latino, and Native American physicians. Again, that's why for Vituity, we create these different programs to kind of help alleviate that with through Impact and through the Bridge to Bridge program. Is really trying to meet those physicians where they are and support them as best as we can. So in terms of trends, has it changed? A lot of organizations have put out there that they are doing many things. They're saying that they're doing many things, but when you really take a look at it, a lot of them are not actually putting action behind those words. I can say Vituity is, but a lot of organizations are not.
So nothing's changed really. It's kind of business as usual. So how high of a priority would you say recruiting with diversity in mind is for organizations?
I would say it's still really high. It's really high for organizations. Again, you have a lot that are saying that they have it high, but when you look at the action behind it,
right.
So it is definitely still a high priority for many organizations.
It's just the leap from being a priority on page to actual realization of that prioritization and hiring practices.
Exactly. It's like asking them, what have you done? Yes, you can say oh, yes, we want to.
It says priority, but.
Right.
Okay. Yeah, I can see that. So what does the future hold for physician HCP recruitment? Are you seeing any new trends like doctors leaving for the profession? Or I'll give you a funny thing I saw the other day on Quora. A neurosurgeon decided to leave neurosurgery to become a hair transplant surgeon. So I'm wondering what trends are you seeing as far as physicians changing roles or leaving or moving back from the front line or moving to the front line?
Yeah, and so I also chatted with my colleague who's the VP of recruiting for Vituity, and to your point, and going back to what I mentioned earlier, is that a lot of physicians and healthcare providers are looking for more of that wellness and that work-life integration now after going through the pandemic. So we're seeing more physicians and healthcare providers looking for less full-time work. They're looking for flexibility, in a way that empowers them to focus on patient care, but also their own well-being. So again, going back to my statement earlier about, organizations need to have wellness programs in place specifically for these physicians and healthcare providers. They're going through burnout. They've been through the trauma of COVID. They're still going through it. And so, we've been able to position ourselves and have strategies around that And this year we're even hosting a retreat, a wellness retreat for healthcare providers to discuss things like burnout and integrating family and work-life balance. So it's not surprising to me that surgeon is trying to switch gears a little bit, something that may be a little less intense after going through, you just think about like them seeing people in the hallways. Again, our physicians describe to us in the hallways, literally dying, and there's nothing they can do to help them. And so I'm sure, for that surgeon, if he was, a part of this whole COVID surge and helping and support, that I'm sure that he probably was going through a lot of trauma as well. Still want to be able to practice in some capacity, but on a less, more flexibility.
So are they going to smaller organizations, or it's simply just working less hours and making sure that instead of the crazy hours that they have more of a structured sort of 9 to 5?
I know what I'm hearing from on the emergency medicine side is more of the and then from residents that are coming out of residency, it's the less hours, more flexibility. Physicians can work anywhere from 14 to 20 something hours, but it's more the flexibility of like, okay, I can go home now and kind of decompress, or again, what are some things that can support me while I'm at work through wellness? Are there outlets that I can have that can be a resource for me while I'm there and I'm going through this trauma and things like that? So it's a combination. I won't necessarily say that they're going to smaller organizations or going to smaller clinics. Some may be, but definitely more flexibility in terms of the hours and the stress.
And what are you seeing for emergency department nurses, for ED nurses? There's going to be a huge shortage of nurses, I think, by the year 2025.
I saw that.
Yeah. Are you seeing an increase in nursing graduates? What are you seeing there?
So we don't have, in terms of Vituity, we don't have several nurses per se. We do have a couple of practice lines that do have some nurses, but primarily we have nurse practitioners. But we may have saw a similar article. I saw that the shortages could be due to like a lot of nurses are retiring as well. But then also a lot of the folks that are going through nursing school, they are also experiencing burnout, and they're also experiencing not being able to find opportunities when they come out of nursing school. So that also could
really
for some. It was an article that I read there for some. Not saying that all nurses, but it just kind of depends. Again, with COVID, how it was in 2020.
Right.
There was a lot of need for them, but then if you didn't have the training, the proper training yet, then it wasn't. The opportunity may not have been there for them.
Ah, wow. That's very surprising. Wow. Well, Mr. Javay Walton of Vituity Staffing, I really appreciate your time today. Thank you so much.
Awesome. Thank you for having me. It was a pleasure. And again, if anyone is looking for career opportunities, Vituity is hiring. Check out vituity.com. Feel free to connect with me on LinkedIn. But yeah, it was a great opportunity. Thank you so much.
And I hope you'll come back again and talk about more trends as you see the trends changing, and hopefully more physicians of color will be moving up the ranks.
Absolutely. Anytime.
Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.